Hi, this is Dr. Sathya Bhandari. I'm an interventional pain specialist, and today we are talking about how to pick that perfect regenerative medicine doctor. Let's talk about the reality of regenerative medicine. It has not been around for a very long time. So it's been maybe a decade that we have started to really look into what platelets and stem cells and all these other biologics can do for your pain complaints. So there's not a lot of data out there. It's a very new field, but a lot of times, these injections are self-pay and they're expensive, and everybody and their mother, I feel like, is doing these type of injections. So it can be really hard for someone who doesn't really understand a lot about how to pick the right person. So today, that's what this is all about. So number one thing that you need to make sure is that look up the physician. And I'm not talking about looking on Google, I'm not talking about on Facebook, social media, I'm not talking about any of those. I'm talking about look at your medical licensing board. So I'm in Texas, so if you look me up, Sathya Bhandari, under the Texas Medical Board, you'll see when I got my license, where I went to school, what kind of doctor I am, what's my specialty, if I'm board certified or not, and most importantly, if I've had any lawsuits or have had my license revoked. Number two is, this is really important. I have seen all kinds of physicians trying to do these injections. And because it's self-pay, there's no insurance company saying, hey, why is a cardiologist injecting somebody's knee? Right? It's confusing. And when you're when you're somebody out there as a patient, it doesn't even strike your mind, and if on the front of their door, if it has regenerative medicine, you're not going to even question the fact that what kind of doctor is doing this. In my humble opinion, I think the kind of doctors that should be doing these procedures should be interventional pain physicians. So as pain physicians, we have been trained, usually with a fellowship, for extensively to do disc injections, to do spine injections, all kind of complicated spine injections, neck, shoulders, knees, hips, whatever tendon injury, nerve blocks. There is no such thing as a regenerative medicine board. So if someone's telling you that they're board certified in regenerative medicine, it's false. There is no such thing. This is such a new field, and that's why it's so important for you to go to the right type of person who's been doing these injections for a long time, and then just using the biologic, which is your cells, to inject into the same place that they've been injecting for the last 10 years. The other thing that's important is for physicians to continue their education, right? So over the last 5 years, I have learned to inject the knee not just the way that I remembered how to inject it in school, but actually much more precisely. So every year I go to further training courses to learn from international experts that we fly in from all over the world who say, hey, we should be doing these injections a little bit differently than we did last year. And so you want people to be part of these interventional societies, to be actively looking and educating themselves. Number two is, or three I should say, is have they reviewed your imaging? You have no idea how many times I have heard patients come in and the physician or whoever it was basically said, we're going to do this injection for you, let's schedule it for next week. They have not looked at an x-ray, they have not looked at an MRI, maybe they looked at an MRI report and that was it. I think that's ridiculous. You've got to know where you want to inject. So when I look at an MRI, I want to see if I'm going to inject into the shoulder, I want to be able to see that there's a tear in which rotator cuff muscle. Okay, supraspinatus. I want to make sure that I can see it on the MRI. So I'm not just injecting around the rotator cuff, but I'm going to inject into that particular muscle, the tendon that has the defect. So that brings me to another point. When you get these injections, are they done with some type of image guidance? So, what I do in my office is I use ultrasound and I use fluoroscopy, which is live x-ray. The reason why I use ultrasound is because if I'm looking for a tendon and and I can see the tendon and it's not too deep inside, covered by bone, then I'm going to use the ultrasound and find my needle, find the muscle. Ultrasound goes right in. I can see the fluid going into that defect, filling that defect, or it's going near the bone where I know where this is where I want to put it. I am not going to waste your money and put it around there. So please, when you talk to that physician who is performing the injection, you want to ask them, how do you plan on doing this injection for me? You should be able to see the suite, right? So you should be able to say, hey, where do you have this done? So if they say I do it at the surgery center, then, the surgery center for sure will have those imaging modalities. Offices, you want to check out their office suite and say, hey, do you mind if I just take a look? I just want to see kind of the facilities. This is the first time you've seen somebody. Unfortunately, there have been too many people that I've encountered that have had injections, they tell me, of stem cells, and nothing, no type of imaging has ever been used. What I also do in my practice, which I think everybody should do, is document the actual images. Ask your physician what type of biologic are they using and why. So I'm a big believer on bone marrow aspirate and PRP, platelet-rich plasma. I have used others in the past. I don't think that they're very helpful, in my opinion, maybe for a very small subset of people, but in my opinion, if you look at all the literature, much of the literature has studied bone marrow concentrate as well as platelet-rich plasma. This is my biggest pet peeve. If you feel like you're at a sales meeting, right, and they're trying to sell you something, walk out the door. Regenerative medicine is a sophisticated, complicated type of medicine that I have a lot of faith and I have a lot of passion for. And I never sell my procedures because I really do feel that patients should understand what they're getting and what they may not be getting. So if you feel like someone's trying to sell you something, it's probably not the right type of environment. If you really feel like somebody's taking you for a ride, they probably are. Listen to that gut, listen to your heart, and do your research. The last thing I want to tell you is that this field is, I think, the best thing that has come across musculoskeletal medicine in a long time. And I think that you should be very confident that you will get a good result as long as the person that is performing this procedure for you really understands what they're doing and has your best interest in mind. So best of luck, and I hope you have a great outcome. Take care. Bye-bye.